And welcome to this special live episode of The Dental Guys. I'm Wes, the Dental Guy.
And I'm John, the Dental Guy, and we are continuing to try to bring you really the answers to the questions that we're all asking this last few weeks. And that's been a wide-ranging set of questions. You know, we've asked a lot of business questions. We've asked questions about loans. We've asked questions about, you know, what do we do next as far as our businesses? But really, you know, the next step is the biggest question of them all, really. How do we go forward reopening our practice? And Wes, we've had so many discussions about this together, and we've been trying to think through it because our state is, as long as nothing changes, we're going to be able to go back to work in the next week and a half. The question is, how do we do that? And
well, I had a team meeting this morning, and you've got a team meeting as soon as this podcast is over, because we want to be able to tell our team, you know, some good, you know, give them good, hard answers on really how we're going to practice going forward. I think we're going to find out today, maybe not all the answers, but we'll be able to kind of say some things because of this show that are going to change maybe forever, because we have somebody that really has been through this change before in the dental industry, because Olivia Wann was a dental hygienist before, our dental assistant before she became a lawyer, from what I understand. I'd like to hear that story today. So let's bring Olivia Wann on the show. I really appreciate her coming on the show today. Thank you so much for joining us.
Thank you so much for having me. So I joined the dental profession in '85, and I was 19 years old. I was hired as a receptionist, and one of the dental assistants saw the need to have me cross-trained, and so I was trained as a chairside assistant and registered. I was registered for many years. It was not my primary position, but I was able to cross over. So I well remember the years we worked without gloves. We didn't wear masks. We didn't use sharps containers. And the reports of healthcare workers getting hepatitis B were in the thousands, occupationally, healthcare workers contracting it. And so those were scary times. And then we had the big AIDS scare out of Florida. And in 1991, OSHA published the bloodborne pathogen standard. So I well remember reading that standard and highlighting it and having to make all those changes. We thought it was going to be impossible to work wearing gloves. And now you wouldn't think of working on a patient without gloves.
Yep. And that's the kind of thing that we now face, is the next, you know, evolution in our practice with this new challenge that we have. And I want to dive right into the questions that we're all asking, you know, given your history, not only as a dental assistant and in dental offices, but then as an attorney. Talk a little bit before we dive into these questions. What types of, what do you do? Because I think it's important that people understand what you do for dental practices, what you have been doing over the years that makes you able to speak to this. So talk a little bit about, you know, your organization, your company, what you do.
So I left private practice 21 years ago after serving as an office manager for so many years. And I started Modern Practice Solutions, which is dedicated to compliance areas of dental practices. And so for 20 years, I've been professionally consulting. And I went back to college, and I have an undergrad in healthcare administration, and I decided that I wanted to continue. So I went to law school, and as a result, I've been practicing law 8 years. And I work primarily with dentists. So we do a lot of consulting on regulatory issues. And I do have a local law practice. I assist dentists also with leases and associate contracts and that type of thing. So dentistry has been my heartbeat for many, many years. And I hope to be a good resource to help answer questions.
Yeah. And that's why one of the reasons we wanted to talk to you is because you have a unique kind of skill set, not only understanding the dental profession, but understanding the compliance issues that we face, CDC, OSHA, state regulations, those types of things. And interestingly, you're in the same state we're in. So that actually, that helps us even a little bit more. So let's talk about these ADA interim guidelines, because that's what we have now. And we understand there'll be some more guidance. We'll talk about that a little bit more. But based upon what we see, what we have available now with that, with CDC, OSHA guidelines, talk a little bit about what this means for us. And some of that may be hypothesis because we don't have, final guidelines. But, we were, I think, a little bit, Wes and I are a little bit worried about the recommendations being kind of loose on, having a surgical mask, an N95, low risk versus moderate risk. And, what do you think things will look like in the coming weeks for people? What gear should we have? And what do these guidelines kind of mean for us?
I think to understand it best, we have to turn back the pages of time. And so when we look back at the bloodborne pathogen standard of 1991, it was for bloodborne pathogens. It was to minimize our risk for exposure during needle sticks and sharps injuries. And so we conducted a hazard assessment to determine what was appropriate for personal protective equipment. And all these years, what has been considered appropriate in a dental setting would be goggles, mask, jacket, gloves, utility gloves, sterile surgeon's gloves, and so forth. And so when we're comparing where we are right now, we were dealing with bloodborne pathogens, and now we're dealing with airborne pathogens. And that's where we've determined that the surgical mask in itself is insufficient to give the workers protection against airborne pathogens such as COVID-19, but even for influenza. It's insufficient due to the gaps here at the face. And so the interim guidance from ADA, which mirrors the CDC's guidance, is that we should use the highest level of personal protective equipment, that being wearing gloves, of course, a gown, eye protection, whether that's goggles or a shield, and an N95 or higher. So this is part of the interim guidance, and we can only speculate that the N95s will be part of a dental setting, because COVID-19 is one of emerging viruses yet to come. And so to adequately protect our staff and even our patients, we need to step up the pace a little bit with our personal protective equipment. Now, keep in mind, if there are no N95s, which is a huge issue, then the minimal acceptable standard would be the combination of a surgical mask with a face shield.
So do you feel like
that's the thing?
Yeah, that's the thing right here is, that kind of begs the question. One, is that adequate enough to go back to practice, like to tell your team and your patients, we don't have access to N95s or KN95s yet. We probably will have greater access midsummer, but I do have face shields for everyone, and I have a level 3 surgical mask. Is that, it says, right here, that that right there is still moderate risk of transmission. Is there any concern for you advising, clients, doctors, dentists? What is your thoughts on that? And do I tell my team, I can't get KN95, so we're going to wear face shields and this, and it says they're at moderate risk of transmission. Is that okay to go back to work?
That's our guideline from CDC. And of course, we are implementing the screening process. So we're not seeing patients that are running a fever. We're not seeing patients that have symptoms of cough or sore throat or that nature. And so we're doing our best to prevent patients coming into our office that are sick. And I can tell you this, I remember when I was an assistant, I really enjoyed working with the hygienists and helping them chart so they wouldn't contaminate the paper chart. And I could remember the hygienist asking the patient, is your throat sore? Because you have spots in your throat. And the patient was like, yeah, I've got strep throat. But, did not have the courtesy to cancel the appointment because they figured they're off work anyway. So I think as dental professionals, we have dealt with the risk of working with patients that could transmit sickness to us. And so in answer to your question, is it adequate? Well, CDC is telling us a level 3. A level 3 is a great mask. It has the filtration to filter out particles. It's the worry of having a gap here. Now, in working with some of the dentists, and that's completely blown me away, is that these dentists are so innovative. I've been communicating with a dentist that he used his 3D printer to make the framework of an N95. So he's got his level 3 mask underneath, the framework of the N95 on top, and then a shield that he made with his 3D printer. That's awesome. And then that's certainly going to decrease his risk and that of his staff members. But supplies will become more available sooner than later. And like I said, it's no different than in 1991. We were told to wear gloves, and there was a glove shortage. You couldn't order them. And then when we received the gloves, you pull them out of the box, they were all stuck together because they were so poorly made. And we effectively overcame those challenges and came back stronger. And I think the same thing will occur. It's just we have to keep safety first and not pardon ourselves from these requirements, but yet look to overcome some of these obstacles. And you may be, curious to know what OSHA's opinion is. I reached out to them here in Tennessee because we do have a very strict program in our state, and explained to them that what are we going to do with we don't have face shields. We cannot adequately comply with these guidelines in light of the shortages. And so we discussed the options of using a welder shield. So if you Google a welder shield, it looks much like a healthcare face shield. It's clear plastic, and it wraps around the face and comes down below the chin. And OSHA would find that as an acceptable way to overcome the hazard. So if there's not something available, we can resort to something comparable. And another thing that I would like to point out is that for the employers, such as yourselves, that OSHA published a discretion of enforcement on April 16th. And in writing, they say, OSHA understands that some employers may face difficulties complying with OSHA standards. And that being, we're working with skeleton crews. We don't have some of the supplies we need. But are you showing a good faith effort to comply? And are you trying to remove those hazards? So even though homemade things are not considered NIOSH certified or anything like that, but I think for this dentist that's wearing the level 3 mask with the framework of an N95 and then has a face shield on top, is very effective at promoting safety, and OSHA would look at that good faith effort that he's making.
Well, that's an interesting, it's good to hear that OSHA has weighed in, because that was something we were kind of looking for your help with, and you've given that to us immediately, which is awesome, because I think everybody has read the interim guidelines, of course, I think at this point from the ADA, but interpreting that is difficult. And I think the biggest concern when we looked at that was the word moderate, right? When you talk about moderate risk, and obviously it's impossible to, quantify what that is, how much more is moderate than low. And, when do we get to the point where it is essentially equivalent to an N95? And as you said, no one really knows. And there's all kinds of creative solutions that people are coming up with to try to get there. But I think that is the guidance that we're really looking for. And so you mentioned before the show, because I want to maybe switch gears a little bit to this guidance becoming more permanent or becoming more clear. You mentioned to us before the show that there's expected guidelines coming tomorrow that will be more definitive. Are those guidelines coming from regulatory agencies or CDC or OSHA? Who is going to be publishing those?
So we anticipate CDC to give us guidance to return to work. So we've had the interim guidance for seeing emergency patients. And so now we're awaiting, and I hope it's tomorrow or early next week, we're awaiting guidance on how do we return to work and deal with personal protective equipment shortages, and what is the new standard, or what we are calling the new normal. And I want to integrate here at this point that it's not just about personal protective equipment. OSHA talks about work practice controls and engineering controls. And so that's where we supplement in overcoming the hazard with different devices. So there's been a lot of discussion about air purification systems, external evacuation systems, modifying how we do a task, such as using a rubber dam, maybe having barriers. So in practices that have open bay concept, could we effectively install some barriers? So there's multiple things that we will do to promote safety in a dental office. And I think it's all part of the process. We just don't know at this point what is mandatory and what would be a recommendation. And so that's part of the challenging part, I think, for dentists.
I think there'll be two phases of this, and tell me if I'm wrong, Olivia. I'm feeling like that there's a phase of mitigation in treating patients. We're going to be in the midst of mitigation of this pandemic nationally, whether we start to localize the mitigation or down to the county or even the city in some situations. But I feel like there's going to be a phase of time where we're going to have like the utmost of like uptick in responsibility, and we're going to be socially distancing as far as even employees in the front office trying to maintain social distances. Certain things might not happen in the reception area. But I guess my question is, after that initial phase of mitigation is gone, what will remain, right? And I think that's some speculation right there. I think it's good to kind of like, we've got a phase of mitigation and treatment because we all have to get back to work. We have patients that are in pain that need to be treated. We're going to probably raise it up really high. So we're going to set the bar so high, and then we're going to probably drop down, right? And based on your experience from what happened back in the 80s, you went, whoop, and then, okay, we've got some science now. Okay, so the science is coming in here. How long before that happens, right? I think that's a good conversation to kind of have.
Well, I looked up airborne pathogens just to be curious of what all was considered in airborne, and it includes measles, smallpox, chickenpox, and we have effectively overcome those risks through vaccination. And then with bloodborne hepatitis B, we overcame it with the vaccination. So hopefully we have a vaccine in the future. But I think the important point to realize is that COVID-19 is one of the emerging viruses. So what will happen in the future? That's another pandemic that we have to deal with. And one of the things that we were missing during this crisis is emergency preparedness. In dental offices, we had masks, we have gloves, we have jackets, but so many offices did not have face shields. They did not have N95s. And so at this learning experience, we will not be caught in this position again. And think about it too, that we didn't realize that so much of our personal protective equipment was made in other countries. And so with our supplies being depleted, we didn't have enough resources, although a lot of the factories have stepped up. I mean, even the car factories in Nashville are making supplies. So I think the future will have a better preparedness for emergencies and emerging viruses, pandemics, and whatnot, so that we're not caught in this position again without adequate PPE.
Well, I think that that's a great point to make, that it's, we're going to be more prepared in the future, and some of these regulations will come and stay because of the potential of other things that could be in a similar vein to COVID-19. I think that it's, first of all, takes some of the maybe anxiety away from me to hear you say that, these standards that we're seeing are probably similar to what we're going to be seeing, with maybe the exception of some other things being added, or maybe being recommendations versus mandates. And that's always the big question, is which things are recommendations and which things are must-dos. And we should hopefully have that soon. I think the other question that I wanted to maybe have you weigh in on, if you can, is standard of care is always the thing that we are concerned about in dentistry. And we look at certain parts of the country and certain cities and certain counties and different places where we have problems with COVID-19, and other places where we seemingly don't. Now, that's, of course, up for debate, whether there's testing or not and all that. That's a whole other discussion. But do you see these guidelines being applied in kind of a local standard of care model? In other words, if you're in New York City right now and you are working in a dental office, you probably need to be doing things differently than if you are in an area that has fewer cases. It sounds like when you mentioned that OSHA is saying best faith or good faith effort, that would almost kind of say, hey, look at your situation, use your judgment, make an effort to do the best you can. Is that the feeling you have? Because of course, dentists are, even though I think we probably shouldn't be so concerned, we're always concerned about liability, right? We don't want to be we don't want to do the right thing. I want to do the right thing, but I also want to make sure that I'm reducing my liability for things either from patients or employees or anything that would come back to me as I didn't do enough. Do you think that that's going to be a locally applied standard, or do you think that this will be kind of, the level will be raised to the worst possible scenario, given every locale, and that will just kind of, everybody will be in the same boat?
Well, I think we need to look back once again. The guidelines that are published by CDC are not regulatory in a sense, so they're guidelines. However, in dealing with OSHA, especially in Tennessee, that we have a very, very strict program, when CDC publishes a guideline, and that guideline is for employee safety, OSHA does have the authority to issue citations for not following the guideline. So that's not changed. And so I've worked with dental practices that have been cited over infection control guidelines violation. So if it pertained to post-exposure management or vaccines or cross-contamination issues, it's in OSHA's authority to issue citations. So we do have to take the guidelines very seriously, that it's not just one of those things that you can try to achieve, but that realistically we need to incorporate it into our practices. Now, granted, I've seen things on Facebook that are just so over the top, like putting a patient like in a plastic box and trying to work on them. We have to remember it's all about abating the hazard. So if we have the right personal protective equipment, we are going to be practicing safety. And it gets back to engineering controls, using the different type of equipment and air purification. What are the things available that we can make our offices safer? And I'm confident that we can. I really am. But we need to take it as seriously as possible and not resist it. I know there's a lot of dental practices complaining about cost, and I get it. The N95s are what, $3 and change each, and maybe right now $10 each.
Yeah.
So your cost per patient is going to go up. Now remember, I was in office management back when all this happened, and I suggested this to a dentist the other day. I remember creating what I called a dummy code in the system for the disposables. So in other words, if you wanted to create a dummy code that doesn't go to the insurance and you're not even expecting your patient to pay for it, but put in parentheses value $25. Are you following me?
Yeah,
so that
yeah. Oh, yeah.
If you gave your patient a walkout statement and it said infection control products for your safety, $25 value, we charged you $0. And I think it raises the awareness of your patients that we are assuring their safety. So communication is key. And I remember working in an office back then, patients were scared to come in. And so I had some dialogue on an index card underneath the front desk so that if a patient complained or they had concerns or they said, wow, did you raise the fees over this? That we had some positive communication to share, that we're doing everything we can to assure the patient's safety during their visit. And it's not only safety for the patient, it's safety for your entire team. And I think that sets you apart from other dental practices that might be resisting some of these changes. So it is about safety.
Yeah, it's so good because I think the more
that
that you're up front, the more you're up front about this and the more that you're like a leader in this and showing your patients that you're a leader. And then I think you've said it best, because John and I create these dummy codes all the time for things that you don't necessarily see, like in a comprehensive exam. You don't see that you did an oral cancer screening. So create a little dummy code that's underneath that. And that creates a sense of like, oh, they did all that for $100. You know, like they did all that and the value was $25 for COVID mitigation phase. You know, I mean, like patients appreciate that. And I think that's such a great point. That's such a great point.
Yeah. So Wes and I are working right now, both of us, on developing documents for our offices, kind of, if you will, compliance documents that are, best practices that we can come up with based upon, what is available now and our understanding of what's available now out there. Things like social distancing and how to handle screening of patients on the phone and how to handle screening of patients when they come in, things like that. What do you think about how far do we take consent here? Because it's such a major issue that we talk about in our practices in the dental world. But when it comes to consent, knowing the fact that even though, we have all these things we can do, do you think this creates the need for consent forms for our patients or even for our team members when they're working, knowing that even though the risks are as low as possible, that we can't eliminate all risk? Or do you think that is, potentially overkill? Because there's a lot of people concerned about how far do we need to go with that?
I've seen one of these consent forms floating around that came from the professional liability company. And if that's what the professional liability carrier wants you to use, then you probably should conform to what they're suggesting. But reality is, and I say this being an attorney, although I'm not giving legal advice, I always have to disclaim that. But the reality is, how would somebody prove that they picked up COVID in your office when they're going to Lowe's and buying plants and they're all stacked up against each other, or they're in the grocery store? How would they prove it came from your office? How would an employee prove that it came from your office? So the burden of proof, it would be really hard to say that it came from the dental office. Where there would be a burden that would be difficult to disprove is if you weren't following guidelines. So if a dentist was blatantly not following guidelines, not following executive orders, then there's a measure of responsibility there. But I think that if you're following guideline and you're screening patients and you're doing what's recommended, that is part of mitigating risk and managing the risk. The risk never goes away. You're always going to get that psycho patient in that's never happy and complains and pops out of the chair and writes a bad review.
Right.
And I hear from dentists on a lot of those things, but that's not going away. Those kind of people exist. But I think we can overcome this. But I think there needs to be good written plans, operating procedures, looking at, we need to implement a respiratory protection program. So it's something I've been working on for my clients. It's a written respiratory protection program. It is required. So if you have N95 use, you have to have it. And then everyone has to be trained. So the entire staff, so we've been doing these webinars, if they all attend, and I give them a roster that indicates they've attended it, that will satisfy OSHA's requirement that they've been instructed about respirators, what their limitations are, what the efficiency is, and so on. And then we have to do the fit testing. So, if we comply with these things, it will become routine, just like what we did with the bloodborne pathogen standard. People kicked and screamed. And especially the older doctors at that time, they're like, well, I'm not going to get sick. I've been practicing all these years and never happened. And I never wore gloves, and I'll be eating a sandwich and smoking a cigarette. So things changed quite a bit.
Yeah.
And we made it.
So good.
You know, I think that's what we're hearing right now.
Yeah, we're hearing a lot about that, and so you know,
it's actually really funny to me because Wes and I didn't know, we haven't talked before, Olivia, but I think we could definitely hang out because like we have a very similar approach. Like there's two ways to look at most things, and this has come up on our show. So I mean, Wes, how many times has this come up in the last like 3 weeks?
I know where you're going, man.
And what we have talked about is the abundance mindset versus the scarcity mindset. You know, just do you have the opinion that we're going to be okay? We're going to get through this. We're going to work hard. Or do you have the opinion of, you know, oh man, the sky's falling. We're all going to die. Worst case scenario. And it's, you know, and that, I think is such it's a bad place to be because the media, of course, feeds that.
They love it.
Feeds this fear, and unfortunately, social media and some of the worst, honestly, have been some of the dental social media groups. It's been horrible because you have people who are afraid.
Don't bring that on the Dental Guys Facebook page, by the way. We're not. Don't bring it over here.
No, don't bring that to us. No, we're not going to talk that way. But we've seen like this interesting thing, and I think although some of those older dentists, right, are crazy people, there's definitely some of them, just like there's crazy younger dentists. I think that there are some things we can kind of take that, hey, we got through, we've been through so much as a profession, we've learned so much, and I think right now the other thing is that people are making, you mentioned money, people are making decisions to spend money, a lot of money sometimes, without any clear science, any clear reason, all out of this scarcity mindset, not out of a abundance mindset. It's like, I'm going to buy, I mean, I've talked to people who bought, you know, thousands and thousands of dollars of things that have been marketed. I'm not saying it's bad. We don't even know if it works. We don't even know if it's needed. We don't even know anything. I mean, are you seeing are people calling you going, should I buy like a UV light system for my HVAC, or are you hearing those kinds of concerns, people wanting to buy stuff?
I am. And once again, that could be part of engineering controls. But what I'm suggesting is, number one, we need to know what is required so we can meet those standards. And then what is FDA regulated? So we want to look for that FDA clearance to make sure that whatever it is that was manufactured meets the facts that it states it has, that it really does work. And how can we make our dental offices safer? And so, I mean, there's going to be a period of spending some money, and maybe not quite to the extent that some are forecasting, but it will be an investment in making some positive changes. And you know, we've all been affected. Everybody that has a business, just like myself. I have 2 businesses, actually 3, and it has been a tough slam. But what I've been telling people is we can recover from economic bruises as long as we have our health and our sanity. So we have to maintain our sanity by not stressing out and making sure we make positive changes, not going overboard and crazy. And then finding out, you know, what is the standard so we can effectively meet it. Just like in working with my law clients, you know, we have met the demands, and now online notary is approved. We could do it via Zoom. I have a week's worth of court cases in May that will be handled through Zoom. So we just roll with the punches. And so rather than stressing out and stressing each other out, we are in this profession. We spent a lot of time in school to get there. We've made a tremendous investment in our businesses and our practices, our dental teams. And so they're looking to dentists for guidance, not fear. And we have to be strong leaders, and we have to provide some solutions.
So let me kind of recap here a little bit for you if you're just joining in, and we've talked a little bit about the ADA interim guidelines. We've established that you have some good guidelines right now on what to do, and then too, we feel like that based on what we're hearing here and what we've heard over the last couple of days is that, there's going to be some changes. Right now, we know that some supply is limited, but we also know that you need to use your best judgment to up your respiratory, right? Respiratory, right? Mitigation
compliance,
in your office and compliance better. And then I think the thing that I heard from her, John, that really helps with me is that we need to go up and beyond, just like we do with CPR. Right? Now, would you hire somebody that works clinically that hasn't had their CPR training? In fact, the government, right, says that you must have a valid CPR card, right, that says you've received training in a certain time period. It's in our bylaws. So now what we're hearing is like, hey, we need to be educated on N95 mask wear. I have a local hospital that I'm a part of right here in town. I'm attending here. I won't mention the name, but I get the updates, and they're talking about fit testing all the time. If you've not been fit tested, then they're providing just-in-time fit testing for their employees with masks. So if you have 10 employees in your office, in your dental office, you need to go through fit testing. And it sounds like that, Olivia, you've extended your services to explain what that means and how to achieve that. Is that correct?
Yes. So as I mentioned, I have prepared a respiratory protection written program. So that will be required in your OSHA materials now because of the N95s. There'll need to be an initial fit test to make sure the wearer has the right seal. And then thereafter, it's annual fit testing. Someone could be trained. And then the user seal check. So every time you put the mask on, you do a user seal check. But an important part of this, if you look at the standard from OSHA, there's also a medical evaluation. And so we can complete the medical evaluation form. But if the employee has medical problems, such as they already have shortness of breath, or they have a heart problem, or they've had a stroke or high blood pressure, among other conditions, then a healthcare professional would have to clear that person to wear N95. And if they have some medical compromises, it may be that they're told they could only wear an N95 part of the day and not all day. So we have to get into compliance with this process. And I'm confident we can do it. Everybody's already getting into place and getting those steps set up, just like with you going to the local hospital. That's a great resource to get the initial fit test. But I want to emphasize, in my regular lectures, I talk to dentists about brand loyalty. And the reason is that, we picked on the old doctors, so let's pick on the young ones now. The young docs will shop the deals. Whatever's on sale, that's what they buy. And that can be a compliance nightmare because every time you introduce a new product, you're supposed to do training. And then you have to have a safety data sheet. It has to be added to the chemical inventory. And then you order something new and it's a different chemical compound. And it's caused problems even with resulting in OSHA violations. So with these N95s, once you get fitted and you know the right size and the brand, it's probably in your best interest to continue that same product line so that you're not having a very difference with it not fitting. So like I could buy a pair of jeans in one size and it fits great, and in a different size, it does not at all. And so I think we need to keep some good records on what we're ordering and not just when this shortage stops, just order whatever's on sale because it might not save money at all.
And this is all, I think, new information for us right now.
Good.
Because we talk about this with composite and bonding materials, buying multiple things for the same reason that you're not actually going to have success with a product if you don't use it for a long time. And this is kind of coming from the same vein that here cost is not the number one thing. Reproducibility, predictability, traceability when it comes to these types of products is huge, I would say. And again, this is all new stuff for me. Having a respiratory protection addendum, if you will, to your OSHA information makes perfect sense. It's something that this is the first time hearing it. Makes perfect
sounds like
sense.
we need to hire Olivia Wann, John. As soon as we get off this podcast,
like we need to just.
So next week,
That's right. Yeah. What are you doing next week? Right. Because we may need your services. But if is this like other types of OSHA training where you can have a person in your office that is trained who can then administer this type of training? Because I think that's people that are listening to this are going, whoa, whoa, whoa. Like, what does this mean for me? Do you need to go through obviously you need to go to somebody who has training. Can you train someone on your team to administer this type of program, or do you need to go to someone who has a specific type of, license or training in this to be able to be compliant?
So the medical evaluations need to be performed by a healthcare professional. So we could never do that part if someone has medical problems that need to make sure they're a candidate. But as far as learning how to do the fit testing and launching these programs, it can certainly be someone on your staff. But whether you choose to do it yourself or you work with an outside party like myself is all dependent on the practice and the dynamics of that practice. What I've learned in working with DSOs, for example, the DSOs usually have a person like me that works for them. They have attorneys that work for them. They have risk managers and compliance people that have had special training in doing this. So the disadvantage for a smaller practice would be they're already overextended in their job duties. And it's hard to say, well, do this in your spare time. Oh, well, when you're not sharpening instruments or you're not activating inactive patients. So it can't be left to when you have time to do it, because it is a very serious role. And so we take that seriously in my practice in offering solutions, whether we give you the tools and you do it yourselves, like we offer the advanced safety manager course so that we spend 6 hours with someone teaching them how to use the books and what things to look for and how to effectively manage and promote teamwork so they can do it on their own with adequate training. And that's probably what OSHA is looking for, is not so much the alphabet after your name, but is that person truly qualified? Because we don't want to be misled in saying, well, that's how I didn't do it that way at Dr. Smith's office, and we didn't do it that way at Dr. Joe's office. What's the right way? And is this person committed to completing it? Because someone that leaves open-ended tasks that are never finished would not be the best candidate to manage it.
Is this something you feel like that we need to achieve before we go back to work, or do you think it's an in-process type of thing?
I think these respiratory programs need to be put in place ASAP. And so that's why I've been working late trying to get it done, because my materials, I try to gear them for dental professionals, because I've seen some dentists using hospital respiratory programs. That's not us. You can't really modify the language that's made for a big, huge hospital that's working on cadavers and people with tuberculosis and whatnot. Right. I'm trying to make it really simple and straightforward. So right now I finished it and I'm having it's in the proofreading phase right now. So just make things simple and clear and easy to understand so that the tools can be used effectively and not and that's what I hate about legalese. Nobody wants to read a document that you need a dictionary to look the words up. So it needs to be very simple. So I think with the greater training that we can offer and getting the tools in place, but because those N95s, I would say it's a little bit sense of urgency there.
Yeah, that's so good.
Well, this is so good. I mean, I've learned a lot just from that, and definitely that goes on the checklist for sure. Yep. And some states that's more of a, if you're in Georgia, you better get on it, right? Because it's coming. And in Tennessee, we're right behind that. So I think we need to be, definitely on that. And, I think it bears repeating what you said earlier that, we've been through these things before. I have a friend who's an oral surgeon, new to practice relatively, and he has been seeing emergencies. He's been working a part-time schedule ever since the shutdown, seeing a lot of emergency patients. And he came in the same way. He was kind of freaked out. He was really worried about this. They got N95s, a limited supply. But I talked to him yesterday, and he was just talking about how after it's been a couple of weeks and you've been taking the precautions and you've been seeing the patients, you start to just go, no one's getting sick. we're okay. You know, like this is not as big of a deal as I initially thought. And it helped me because I'm still a little bit worried and nervous about this just because of the unknown and because of what all is out there. And there is a legitimacy to being concerned. I mean, we need to be concerned, but I think you're helping us to kind of go, hey, the reason OSHA is there, the reason CDC is there, the reason these organizations are there is to tell you, if they say this is the guideline, this is the minimum requirement, we can feel good about that. And I'll maybe ask one maybe final question. How do you feel about these states? And I don't know, you may or may not have something to say on this. I'm not sure. There's all this question about, will dentistry go back? Because obviously these states are reopening in phased reopening, and certain businesses have been called out, hey, you guys are going back to work. Do you think that dentistry will be in that first phase, or do you have any idea that maybe we will be pushed off a little bit longer due to the fact that we are generating aerosols and things like that, and the fact that these regulations are kind of just coming out? Do you have any feedback on that or anything you've kind of heard about that?
I think some states will put it off further. I know that a lot of the speaking engagements that I've had were canceled because everything's been shut down and dental offices are still not back to work. So some states it'll be longer, some states sooner. But one of my concerns, and I don't know if you were going there or not, is that some of the dentists have been so scared that they've not been handling their emergencies. And that concerns me because it can lead to allegations of patient abandonment. So serving your patient's dental emergencies is important. And if you do not have adequate PPE as stated in the guidelines, then the patient should be referred to another clinician. So not just to find another dentist, but here's a dentist that can take care of your needs that has adequate PPE. And then when we return to work, it will be the new normal. It's not going to be like it was before. And that's where we're awaiting guidance, because you think about an orthodontist that might be seeing 90 to 120 patients a day. Will it be that same volume? And so those are some of the uncertainties that we face. So we're awaiting guidance so that we can share the information with each other and prepare. Yeah.
Well, I think that's the answer I kind of expected you to give, was that, we need to be sure, even if we're not back in full swing, that we're taking care of our patients, and also that we're finding ways to educate our patients about what we're doing. I think that's, you mentioned that earlier, that, just simply talking to patients, whether it's putting a dummy code in the checkout, whether it's, putting video up on social media of all the stuff that you are doing, all the gear that you are using, how you're learning about this, the fact you're taking special training to be sure that, patients are safe. That only is going to help us to get back to capacity quicker, and to take away that fear. Because this is an interesting time. It's the first time that in a lot of our practice lifetimes that we've been marketing against fear, in a different way, That's instead exactly of marketing for aesthetics or, pain issues or, sleep apnea or whatever. Now it's fear of this unknown, that I think we're going to have to market and discuss and talk about more than ever before. And all of that potentially while wearing an N95 mask the entire time. Right. That's maybe my biggest concern, is for communication between the patient and the doctor. I'm concerned about even just that, like facial expressions will be lost.
You're talking about during mitigation.
Let me share this with you. When we first had, in 1991, that just kind of shows how old I am, but in 1991, when we were told to wear all this personal protective equipment that we had never worn, I remember seating a patient. I was probably 21 years old, and I was seating a patient, and I had the gown on, the gloves, the goggles, the mask, and the patient looked at me and said, "I don't have HIV. You don't have to put all that on." And I had to explain to the patient, this is for your safety as well as mine, and we treat all our patients the same. So it doesn't matter if you don't have anything or if you had HIV. This is the standard now. But I can only imagine looking back how I probably scared him.
Yeah.
Mm-hmm. Yeah. And that's what we're thinking about, is how we get ahead of that, how we let people know, because I'm thinking about like with kids, and with practices where you've got a lot of anxious patients, even just having treatment planning discussions with patients, these are going to become things we have to figure out how to do in a new and different way and innovate in this way that we never really have. So I want you to, first of all, this has been awesome, Olivia. This has been,
thank you so much.
Exactly what we kind of hope we'd be able to get, from your expertise. I think it's made me feel a lot better. I think a lot of our listeners are going to just feel better about trusting in, our regulations and our stuff and doing it right, but also knowing that we do have what we need. Stay on the line after we finish, because I want to talk to you about the training. And I think that if you've listened to what Olivia is saying, I think probably you're going, okay, I noticed there's a hole in my game. I need to have this training. So you're probably looking her up. And if you, she mentioned at the beginning of the show that she has a consulting business, Modern Practice Solutions, so you can find her there. And I think there's going to be lots of people looking her up after the show. If you've liked what we've brought to you today, if this has been helpful to you, I know that it has been, because there's just not a lot of this kind of stuff out there. So we're trying to bring you some high-level people like Olivia to help you navigate the waters of what to be doing in your practice. If this has been helpful, give us some good feedback on the social media outlets with Facebook and Twitter and Instagram. And very importantly, if you would, be so kind, go to Apple Podcasts and leave us a 5-star review. That's how a lot of people find out about us. And it also gets our message out to more people to help more people know what to do now and as we go forward into these kind of crazy times. We will be definitely bringing you more of this type of content in the coming weeks. Next couple of weeks, we'll be maybe transitioning back into practice. That'll be a wild ride. We'll definitely document that along with you. We're interested to hear what everybody's doing in their own practices right now. So thanks again for listening. For Olivia, for Wes, I'm John, and this has been an episode of The Dental Guys.